Good afternoon, everyone. I would like to introduce my audience to the left and to the right. And now we can begin. All right, my name is Hannah Cole, and I'm a survivor of peripartum cardiomyopathy. Now, this evening, we're going to continue our discussions in raising awareness of peripartum cardiomyopathy. We're also going to go over the importance of early detection and what we can do to help. Now, the Investigative Cardiomyopathy Association team have been working very diligently over the last 10 years, and we've made some major breakthroughs in diagnosing this disease early. And I would like to share some of that information with you guys this evening. The Harvard Business Review has stated that since 1991, the maternal mortality rate has doubled. The United States is currently having the highest maternal mortality rate for all of the first world countries. And peripartum cardiomyopathy is one of the leading causes of death and maternal mortality. So with that being said, let's continue our discussion in what is peripartum cardiomyopathy. And basically, it is a rare form of heart failure that's developed in the late stages of pregnancy and up to 5 months postpartum. Now, although we still do not know the cause of this disease, we have made breakthroughs, and we know that early detection is key to survival. I'd like to share with you a little bit of my story and how I was diagnosed. So it was a first-time pregnancy. I had never been pregnant before, and honestly, I had a normal pregnancy up until about my third trimester. Things kind of started to go south. It started with this huge wave of fatigue where I felt like I was tired all day long. I got this shortness of breath to where I couldn't walk from my car to the steps of the grocery store without having to sit down and catch my breath. And then I had this major swelling where my feet would swell and it would go all the way up to my knees, and I couldn't bend my knees in order to get up or sit down. And when I would wake up in the morning, the swelling was just as worse, if not worse, when I'd wake up. And then I had this cough, this unexplained, weird, funny cough where I didn't have allergies, I didn't have asthma, I wasn't sick, and no one could really tell me why I had this cough, and nothing they were trying to do to treat it was making it better. Fast forward to 5 days postpartum, I had delivered a beautiful, healthy baby boy on Monday, and by Wednesday, we were discharged from the hospital, healthy and ready to go, and by Friday night, I was being rushed back to the ER because I couldn't breathe. Now, the rest of it is a bit of a blur, but I spent the next week or so in the cardiac ICU where I was given the devastating diagnosis that I was in heart failure. And here I was, a first-time mom, and I spent my first week of motherhood basically fighting for my life. Yet I was one of the lucky ones because I survived. So last week, we talked about the signs and symptoms of peripartum cardiomyopathy, how it basically mimics late-stage pregnancy symptoms. And I fit all the criteria. I had the swelling, I had the unexplained cough, I had the fatigue, I had the shortness of breath. I even had this increase of weight gain where I was gaining 5 to 10 pounds every couple of days. Just being in the hospital for 2 days and being on diuretics, they were able to take off 45 pounds of water weight. After 2 days, I was essentially drowning in my own fluids, which is why I couldn't breathe. We also talked about some of the treatments like beta blockers and diuretics and ACE inhibitors, and then we went into the more invasive procedures such as live vest, pacemakers, and ventricular assist device. But what about the mothers who have to have heart transplants? And what about the mothers who don't survive? What if there was something we could do to prevent this disease from getting worse? What if we could save one life, one mother, and one child from having to live with such a loss? Now, the Department of Cardiology in the Biostatics Division of this Research Sinai Medical Center has stated that if a mother can be diagnosed with cardiomyopathy before her ejection fraction reaches 30%, they have a 95% chance of survival. So that leads me to my next point. What can we do and what are we doing to help this? The first thing is Dr. James Fett has created a self-test checklist. And basically, it's a questionnaire that asks you a series of questions that will give you a score from 0 to 12. And if you score greater than a 5, you should be sent for further cardiac testing. Now, this test was validated in the U.S. National Library of Medical Medicine in March of 2011. Now, I did this test on myself, basing it off of my own pregnancy symptoms, and had this test been given to me, I would have scored a 12. So I would have been sent for that further cardiac testing, and I could have been diagnosed sooner and given medication before irreversible damage was done to my heart. I've worked in the medical field for the last 10 years, and I know that implementing a simple questionnaire is something that any clinic's protocol can add. We use them for all sorts of reasons. We use them to diagnose someone's pain severity on their pain scale of 1 to 10. We use it to get someone's depression and anxiety levels. We use questionnaires to see if someone has ADHD. So why wouldn't we use a questionnaire to gauge if a person is suffering from heart failure? It's really simple. The next thing that's been done is a blood test. So Dr. Akella published in the Women's Health Journal, she had a major breakthrough, and what she realized is pro-BNP levels, which stand for protein brain nucleic peptide levels, are significantly higher in peripartum cardiomyopathy mothers as opposed to a regular postpartum mother. She did a study, and when she compared the blood samples with each other, what she realized is that a peripartum cardiomyopathy mother's BNP levels is 5 times higher than a regular postpartum mother. This is a huge breakthrough, and what it means is that this test could be given to someone multiple times throughout their pregnancy in order to diagnose them with peripartum cardiomyopathy, especially the mothers who are at a significant increased risk of developing this condition. We use this for all sorts of things. When you're pregnant, you're tested your glucose levels for gestational diabetes. They test your urine sample every time you're seen to see if you're suffering from preeclampsia. You get your blood pressure taken every time you're seen as an OB patient to see if you're suffering from hypertension. So why wouldn't you take one more blood sample to see if a mother is suffering from heart failure? All of this brings me to my last point. Over the last year, I have been working with a nonprofit organization called Save the Mommies. And our main goal and objective is to raise awareness of peripartum cardiomyopathy. Now, what we have done is created a petition to send to Congress. And what this would do is mandate that this pro-BNP level test be mandated for all clinics to add this to their protocols. We could save lives one life at a time. We could save a mother's life. I will attach the link to this petition, and I encourage everyone to take a look at it and to give it some thought. And if you'd like to sign it, it really could save a mother's life. So in conclusion, today we went over the significance and the importance of diagnosing peripartum cardiomyopathy early. That if it's diagnosed before that ejection fraction reaches 30%, the mother has a 95% chance of surviving and making a full recovery. We rediscussed peripartum cardiomyopathy, its signs and symptoms. We went over the treatment options, and then we brought in Dr. James Fett's self-test check questionnaire. We went over Dr. Kellam's pro-BNP levels, and we talked about the Save the Mommies organization that could really save mothers' lives. Thank you all for giving me this time. I appreciate you sitting here and listening to me. Peripartum cardiomyopathy is something that will always be near and dear to my heart. Have a great evening.